Burn injuries are very common in Ghana. Household burns make up a huge percentage. This is likely because approximately 80% of households use open fires with biofuels like firewood and charcoal for cooking. Also, many households do not have a separate kitchen from their living areas. Our traditional cooking stove, which we call the coal pot, is at about a height of less than 2 feet, within easy reach of children less than 5 years. It is therefore not surprising that greater than 70% of all pediatric burns occur among children less than 5 years. The burden of burn injuries on burn survivors begin from the inpatient phase and ranges from physical, nutritional, psychological, financial, and social. The treatment process is long, painful, and expensive, and many are not able to afford these basic necessities of burn care. I remember many instances while I was on the ward where I had to share basic wound care items like cotton wool and gauze with other people because they could not afford. Some patients had to bear the discomfort and potentially risk infection by stretching out wound care dressing to 5 to 8 days because they could not afford optimal care. Apart from wound care, purchase of medications is also a problem. Even at the point of discharge from the hospital, some people have to rely on the benevolence of a few individuals and nurses to pay up their hospital bills. Follow-up after discharge from the hospital is also a challenge. Some survivors have to travel long distances to reach appropriate health facilities for review. The transportation cost and cost of follow-up laboratory tests pose a huge challenge for burn survivors. Additionally, post-burn rehabilitation services like physiotherapy and psychological support are very few, far between, and very expensive. These services are so limited that many doctors don't even bother referring underprivileged survivors to them. Another major challenge burn survivors face in our part of the world is stigma that comes with deformity. Many burn survivors suffer scarring on various parts of their bodies. Sometimes these scars are very disfiguring. There's very little education on this, and there's a sparsity of trained social workers or advocates for survivors in the communities. Coupled with some traditional cultural beliefs of deformed or disfigured people being non-human, burn survivors with disfiguring scars suffer both societal and self-imposed ostracization. Essentially, their lives as members of the community, be it school, work, employment, relationships, marriage, all come to an end. We have a national health insurance scheme in Ghana, which in writing should cover reconstructive surgeries. However, in reality, the scheme only supports burn survivors with less than $3 a day for adults and $1 a day for children, using current exchange rates, of course, and which has a cap of less than $70 maximum cover per person for the period of admission. This in effect covers the cost of accommodation on the ward for a maximum of 1 month. It does not cover medication, feeding, surgery, anesthesia, wound care, psychological rehabilitation, physiotherapy, movement aids like wheelchair, adjuncts like eyeglasses. It doesn't cover any of this. A burn support group has also been started, a government hospital initiative at the Reconstructive Plastic Surgery and Burns Unit of the Kolebu Teaching Hospital in the southern part of Ghana. It has a good number of burn survivors active. Although this is a great initiative, it is only accessible to those within close proximity to the hospital, as travel costs can also pose a barrier. It is my belief that the most important thing NGOs like Beyond Burns International can do is create awareness. The more noise we make, the more others can become aware of the situation and contribute to the solution. In addition to this, we must continue to educate on causes and prevention of burns and advocate for better health coverage for burn injuries, including better equipped and manned health facilities and community acceptance of burn survivors. Where we can continue to financially support some survivors as they navigate the journey towards rehabilitation. Lastly, I'm happy to be part of this unified global voice. Congratulations to the organizers of this conference. I salute you for taking out time and resource for the cause of brands. Thank you.